Let me just say out front, my main message today, it is going to get worse before it gets better. That's the reality. I mean, we've got a couple of cases here, but it's pretty clear to me in the last week, the momentum on this. We need to get better prepared than we are today. We need to have 24-hour testing. We need local testing. It's taking way too long, up to 5 to 7 days by the time it goes to Tampa from here and goes up to Atlanta. It's just way too long. That's got to change and change quickly.
We are screening visitors that come to our facility based upon the FDOH guidelines. And we're also ensuring that we have proper PPE for our caregivers, should PPE be necessary for the treatment of any infectious patient. Finally, or actually third, we are ensuring that, again, we're focused on people knowing how to use effectively and properly PPE. That's very important. And then finally, we're ensuring that as we go forward, that we're continuing to focus on infection prevention day in and day out, which we do each and every day here at the hospital as we've been managing infectious patients for years, right? Whether it's influenza, tuberculosis, et cetera. So those are the 4 things that organizationally we're doing each and every day. We're going off of what the Florida Department of Health recommends that we do in terms of whether an individual has traveled to a particular area that's been identified by the CDC, whether that individual has come in contact with someone who is currently under investigation, and or whether that individual has either a fever and or a lower respiratory illness. If the individual answers yes to any of those, that individual is masked and then taken in a particular route outside of the building to the isolation room in the emergency department where they will then be assessed.
I think we need more transparency and more information because they're the ones on the front line. They're working with the hospitals, but it's pretty clear to me, and same thing in Sarasota County, where they came to my meeting before and then they leave at the time where we get a chance to talk with the press and the people. And I don't think that's appropriate because they've got most of the information themselves, and they're working closely with like Blake and other hospitals as well.